I will present the product description of our company. Our product is from aquatic raw material, which is golden thread fin bream, Nemipterus regatus, and silver white croaker, Panahia argentata. The raw harvest area is at East Coast Sea, Malaysia, and the raw material that we will receive is directly from the harvester, and the finished product of our company product is frozen surimi. The nutritional properties in our frozen surimi is water, protein, sucrose, sorbitol, polyphosphate, fat, and calcium. And the food additive, ingredients, and processing aids in our frozen surimi are sorbitol, sucrose, polyphosphate, protease inhibitor, water, and fish flesh. And the expiry date is 4 months after manufacture. And the packaging that we will use is aluminum foil and corrugated cardboard. The way that we will ship our product is shipped in the firm's refrigerated truck. And the frozen surimi is for raw material for fully cooked imitation seafood products only. And this frozen surimi is for general public. And for user instruction, please keep in the freezer with 0 until 5 Celsius after open the pouch. That's all for the product description. Thank you.
For process flow diagram and plan schematic, this is the process starting with receiving raw materials, heading and cutting until the storage of the product.
After conducting inspection and observation that include the checking of process in making surimi at the site, also check the arrangement of material and equipment, and we also check the work of worker on the site from time to time. We have approved the flow diagram and plan schematic.
7. Haccp principle.
So this is the list hazards associated with each step. There are 7 lists for the hazards associated with each step. First, we have to consideration of the likely occurrence of hazard and the severity of their adverse health effects. Second, the qualitative and or quantitative evaluation of the presence of hazard. And then survival of multiplication of pathogenic microorganisms, production or persistence of toxin, the harder effect, the number of consumer potentially exposed and their vulnerability, and lastly is any food safety objective or manufacturer's food safety requirements. This is Haccp decisions 3 to determine CCP. There are 3 questions for this Haccp decision 3 to determine CCP. Start with, does this step involve a hazard of sufficient risk and severity to warrant its control? And then second, does a control measure for the hazard exist at this step? Lastly, is control at this step necessary to prevent, eliminate, or reduce the risk of the hazard to consumer? Step follow with yes or no.
A minimum or maximum value to reach food safety must be controlled in order to prevent or to eliminate the hazard to an acceptable level. Each CCP must have one or more critical limits to be monitored. A critical limit are parameters that must be able to be measured by a parameter or can be answered by yes or no. Critical limit can be time, acidity, expiry date, and temperature.
Establish monitoring procedure. Types of monitoring procedure. First, quantitative measurements such as measurement of temperature, time, pH, and water activity. Second, observation by a trained individual such as manual sorting. Establish deviation procedure. A deviation is a non-conformance with approved standard operating procedure and establish GDP standards such as the EU GDP guidelines, relevant EU regulations and directives. The deviation procedure. First, detailed process such as identifying, documenting, investigating, and closing deviations. Second, RP involvement. Third, incorporate quality risk management, and lastly, deviations log and an associated form.
Establish procedure for verification to confirm that the Haccp system is working effectively. Establish procedure including random sampling and analysis to determine if the Haccp system is working correctly. Validation should include action to confirm the efficacy of all elements in the Haccp plan. Establish documentation concerning all procedures and record appropriate to this principle and their application. Documentation and record keeping should be appropriate to the size and nature of the operation. Documentation include Haccp plan and support communication, CCP monitoring, log of corrective action, and record of verification activity. Thing to include is ingredient specification, data to support efficacy of preventive measure, data from monitor CCP, storage and distribution record, and deviation report.